Hi, this is Dr. Nick. I'm the Incrementalist here with incremental insights for better business, better health.
And I'm Fred Goldstein with Accountable Health, here working with employers and other companies on keeping their employees healthy and reopening strategies and operating around COVID. So, Nick, another week. It seems like each week gets bigger and bigger. The term Delta has really taken off. Obviously, a lot going on with Delta. What are you seeing?
I think the airline's doing fine, Fred. What are you talking about? I'm sure somebody else has made that connection. They tried to disassociate the name from anything that people, but turns out. Anyway, yes, the Delta variant. So, we continue to learn. We've seen it. I think it's now at 80% of infections here in the US. It, accelerated in other countries. I think we've called it out on our discussions. There was a clear expectation. It is more effective. I've heard various estimates, most recently at least double. And part of that is that it produces more virus quicker in the nasopharynx. That's the sections behind the nose, in the back of the mouth. And that means that it spreads more virus. We've talked about the infected deposited dose, or the IDD. The more virus that is exposed to you, the more likely you are to develop the disease. And interestingly, the other piece of data is it's spreading about 2 days earlier, which means that we have people who get the disease, may not be symptomatic, so we don't know because we don't have widespread testing in place, and they're out and they're spreading the disease. So there's a number of factors that are contributing to this acceleration, but notable, it is impacting vastly more of the folks that are unvaccinated. And multiple people have said it, I've said it, we have a pandemic within a pandemic, the pandemic of unvaccinated individuals. And it's skewing younger because they're the people that are predominantly less vaccinated, in part because they had less access, but also a lot of folks are refusing to get vaccine. We're only scraping over half of the population.
Yeah, it's pretty amazing, and watching that impact too around the communities. You're really seeing hospitals begin to struggle with the numbers of individuals coming in, whether it's here in Jacksonville, Florida, and obviously Florida is leading the nation in terms of new infections. In fact, it's fascinating that our governor yesterday came out, forcefully said, "Get vaccinated. Vaccines work." This is a message, obviously, we need to get out to people. I know we'll be discussing some of that later, but I think even this morning I was reading in Kansas City, the University of Kansas Hospital is reporting that they're full. Other hospitals are reporting the same issues around the country. So individuals who are unvaccinated, and given the fact that it does spread so easily, and we now go around to places and see so few individuals wearing masks and practicing some of those non-pharmaceutical interventions that we've talked about forever. You're hearing some communities bring it back. I think it's really important for people to consider whether vaccinated or not. If you're going indoors at this point, you really should be considering wearing a mask and watching your distance.
Yeah, and that brings up a upcoming conference that both you and I are scheduled to attend, the HIMSS, which is the big conference that got canceled, right at the beginning of the pandemic. It was one of the first that sort of fell to that challenge. And here we are with a rising instance, and it's taking place in Vegas. They've gone through a process of vaccine verification. I'm not sure. If you're not vaccinated, you definitely can't get into certain areas. I don't know if you can attend. You just, can't attend. And they're verifying it as best as they can. But is that enough?
Yeah, I think it's a great point, Nick. And, perhaps you want to discuss this more. Being in a large group, but individuals vaccinated, there is still some risk. Is that true?
Yeah, I mean, let's be frank about this. If you've had, let's pick Pfizer, Moderna, and all of these numbers start to merge, but recollection, they were about 95% effective. So that meant that at least 5% of the population who were vaccinated can still get and might get COVID-19. Now they get it at a much lower intensity. They don't get the severe disease. They typically are not admitted to hospital. and are not dying from it. So all good news, but you can still get it. And with the Delta variant and all of this spreadability, that means that they can potentially spread it. And this particular variant is much more agile at locking onto people. And we think that that increase in the Delta variant is reducing some of the effectiveness. Can't quote the numbers here, but certainly. So at that point, you're going, do you want to take the risk? We want to reduce this. We want less infections, because the more infections you have, the more chances for a variant to emerge that becomes even more problematic.
Yeah, and this brings us back to this point that people are talking about, and that is, living with the virus. And the question is, you can look at that in two ways. One is to live with the virus and just sort of forget about it. Oh, I'm going to live with this thing. And the other is the more responsible approach. How do we do that? And I think that's what HIMSS, may want to take a look at. Perhaps the individuals who are vaccinated and immunocompromised might make a decision that this might not be the best place to come. And others may say, hey, it's time to maybe do masks. So it'll be interesting to see. Obviously, I'm still planning to go. I assume you're planning to go as well.
Yeah, I'm planning to go, but bear in mind the other thing that bears into this decision is where it's taking place, and Vegas is actually, I think, on a tear in terms of increase, partly because the place is awash with folks coming in from all sorts of places. It is a big melting pot, so it's not just the conference. We're not confined to where we are in this vaccine bubble. We've all got to get to our hotels. We've got to walk through those, forums and areas. So I think huge concern there.
Absolutely. And obviously with the unvaccinated and the population, I think Vegas actually is leading the nation now in large cities in terms of infections, with Jacksonville #2. So let's get on to this whole issue. We keep seeing this stuff about people saying all the disinformation out there about the vaccines and the virus. What's happening there, Nick?
Yeah, so I trying to be logical about this, and I always start with what would persuade you to be vaccinated. You and I know you are, and I certainly am. I've declared this. We are vaccinated and very grateful to have access to that vaccine. If you're not vaccinated, why are you not vaccinated? And what would persuade you, or what is dissuading you of the step to do so? We've seen a number of stories of people sort of desperate, young folks on lung transplant lists, or actually having lung transplants as a result of having COVID-19. So we know vaccines will diminish and reduce all of that impact. Their safety record is extraordinarily good. The question is, how do we persuade those folks? Who can I persuade today that vaccines are safe and it is your best pathway to actually preventing the disease in you, your children, your elderly relatives, and all of the people around you? Who do you care for enough to get that vaccine?
Yeah, I think getting that message out individually may be the better way to do it at this point, as we're seeing a lack of response to the higher ranking or the experts say do this and do that. So once again, another fantastic week. Unfortunately, we're seeing this Delta surge. It's great talking to you again, Nick. This is Fred Goldstein with Accountable Health. If you'd like more information or reach out to us, please go to accountablehealthllc.com.
And this is Dr. Nick. I'm the incrementalist here with Incremental Insights for better business, better health.